getting dressed, getting undressed, walking from one room to another, getting out of a chair, getting into a tub for a bath. These things became chores for me. So I knew something was wrong, and I went to the doctors and they examined me and they told me that I had the beginning stages of Parkinson's.
Parkinson's disease is a motor system disorder that's caused by a slow deterioration of the nerve cells in the brain. Shortly after his diagnosis, Harvey Sawson was referred to the Rehabilitation Institute of Michigan in Novi, where he worked with physical therapy clinical specialist Janet Ellis.
Some of my patients have come in and said, they don't go out anymore because they can't get up out of the chairs, or they can't get up the curbs anymore to go to the store. So they stay more homebound.
The Rehabilitation Institute of Michigan is treating Parkinson's patients with the most advanced treatment available. LSVT Big is an innovative and clinically proven method for improving movement, perception, speed, balance, and overall quality of life for Parkinson's patients.
Step as big as you can.
Right. Big. Big. Big.
Good. What LSVT Big does is address that smallness of movement that results from the Parkinson's. It's done under a doctor's prescription. It's given 4 days a week for 4 weeks. Each session would start out with specific exercises that are designed to teach you how to move big with your core and also with your upper extremities and lower extremities, getting them to reach as far as they can, step as big as they can, turn as far as they can.
She was very specific about the fact that think big, walk big, stand big. I believed in it right away.
Parkinson's disease can also affect communication. Clinical speech pathologist Sue Tucker is using a treatment called LSVT Loud to improve patients' vocal loudness, intonation, and voice quality. Sue is one of a number of RIMS therapists who are specially certified and trained in LSVT techniques.
So when we ask them to speak more loudly to get to normal loudness, they feel like they're shouting at first, and so it's really difficult for them to at first adapt to that and to recalibrate their system. I meet with a person with Parkinson's disease and really talk about their daily routine. What kinds of things do they say? How does their day sort of flow? And then we develop utterances, things that they say on a regular basis that we practice. Let me hear it nice and loud.
Arlene, help me with my hearing aid.
There you go, that's right, very good. What's the next one on the list?
Turn off the lights.
Let me hear that again, nice and loud.
Turn off the lights.
There you go. Mr. Gendelman is a gentleman in his late 70s who developed Parkinson's disease about 2 years ago. He and his wife are very active. They have a very large social network, but he was finding that he was repeating himself quite often, and it became so laborious sometimes to communicate with all of his friends in a social situation that he started to withdraw. He started to rely more on his wife. And through the program, he participated for 4 weeks. We did get him to the point where he was louder and, even better than that, more confident when he was in social situations.
Yeah, but this has helped you, and you have exercises that are familiar to you that you do, and you're able to project your voice. I heard you all the way in here from the room over there.
Well, that's like a prize.
Both LSVT Loud and Big work well for individuals with early or chronic Parkinson's disease. To get a prescription for outpatient treatment, talk to your physician. To learn more or to find a treatment center near you, visit rimrehab.org/Parkinson's.